I've been a regulatory medical writer for the last 2 years, and today I want to help you to land this job as well. So we'll talk about the writing test, and we'll talk about the interview, what to expect and how to answer these questions. And right now in front of you, there is an example of a writing test you might get, and at the bottom right here, I have the answer, right? So if you want to follow me, then I left this table in the description down below together with the answer, so you can open the link and you can find all of this there and get back to it anytime you want. So let's look at what we have here. So this is a summary of treatment-emergent adverse events, or TEAEs, which are also abbreviated right here. Okay, and this is what you will receive most likely. A table with safety data, and you will be asked to summarize this data. So let's go through the table. Let me tell you what is what. So we have 4 treatment groups here. So we have people who received placebo, 10 of them. Then we have 10 people who received 10 mg of MJJ. So these are my initials. There you go. I wish I could name a drug one day after my initials. And then 10 people who received 20 mg, 40 mg, and overall we had 40 people in this clinical trial. And these are the TEAEs, right? So treatment emergent adverse events. The overall number, and then were any of them serious? Well, none of them were. Did any of them lead to discontinuation, or did they lead to death? Okay? And when we talk about severity, how many of them were considered mild, moderate, or severe? And then we talk about treatment emergent related TEAEs. So when we talk about treatment related, what we mean is that they are related to the treatment, to the drug, to administration. So to placebo in this case, or to MJJ, right? So these are the overall adverse events that were considered treatment related. And then did any of them were serious, lead to discontinuations, deaths, and then were they mild, moderate, or severe, right? And you've got a lot of numbers here, and they might be a little bit confusing to read. But we have this explanation here that NP percentage any statistics is presented. So let me show you what it means. So for example, here we mean that this is the number NP, number of participants, okay? This is the percentage of participants in the treatment group. So we had 10 people in this treatment group. So 3 out of 10 is 30%. And then we had 7 events, 7 adverse events. So 3 people, which was 30% of the group, experienced 7 adverse events. This is it. And now we need to summarize this data. And what is really important is that you understand what information here is key, because we're not looking for you to just explain everything that is in the table. We just want some key information pulled out. And I've written a short explanation here, and to be honest, this is what? 150, 160 words. So it's not much. So let's look at it. The first most important part here: were any of these adverse events serious? Did they lead to discontinuations or death? And all of them are 0. They did not happen. So we start with this. There were no deaths, serious adverse events, and discontinuations from the study due to a treatment-emergent adverse event following MJJ or placebo administration. Okay, now we can talk about the total numbers. So we had 21 people who reported 35 adverse events, right? This is what we have here. Let's talk about this. And then let's break this down into the MJJ and placebo, okay? So a total of 35 adverse events were reported by 21 participants, with 24 in 11 participants who received MJJ, and then 11 in 10 people who received placebo. So where do these numbers come from? 24 TEAEs in 11 participants. So 5 plus 3 plus 3 again, that's 11 participants. Now 9 plus 7 plus 8, right? So these are the TEAEs, okay? And then we have 10 participants, 11 adverse events. So this is what we just summarized. The other thing that to note here is, are there any trends here? Does the number of adverse events increase with the dose here of MJJ? So we have 5 people here and roughly 2 times more adverse events. 3 people here, again roughly 2 times more adverse events. and then 3 people, and again, roughly 2, maybe 3 times more adverse events. To be honest, these are not major changes, and with such a small pool of people, we can't really draw any conclusions. So I'm going to say here, there were no apparent treatment or dose-related trends in the number of treatment-emergent adverse events reported. At 10 mg, 5 participants, which was 50%, reported 9 adverse events. At 20 mg, at 40 mg, Okay? Literally just a description of what we've got here. Fine. Now we can jump down to severity. Okay? So how many of them were mild? How many of them were moderate? What is happening here? What we're really interested is these ones, because these are the ones that happened in MJJ treatment. So let's focus on them. In participants who received MJJ, all but one adverse events were considered mild in severity. Okay? One adverse event was considered moderate, and there were no severe adverse events. Let's have a look. So this is what we're talking about. So yes, we have quite a few of them that were mild. We have only one here that was moderate. We don't have any that was severe. That's what we just described. And then the next step, we can jump to treatment-related adverse events. Treatment-related adverse events, ones that were considered by the investigator to be possibly or probably linked, related to the treatment. This could be placebo or MJJ administration. So let's have a look. So these are the total numbers. In total, we have 9 people who experienced 16 events that were treatment related, in opinion of the investigator, but we didn't have any that were serious, led to discontinuations or death. Okay, so we can quickly talk about this as well. So overall, we have 16 treatment-related adverse events reported in 9 participants, with 13 in 6 participants who received MJJ and 3 in 3 participants who received placebo. Right? Of course, I could talk so much more about this here. I could talk about the trends. I could talk about how many of them were mild, how many of them were moderate, right? All of this. The reason why I'm not talking about this and I'm not spending really much time on treatment-related adverse events is because the health authorities like FDA, they don't really care that much about what the investigator thought. The investigator considered them to be treatment-related or not, because they want to make this judgment for themselves. So in general, they will only look at the top of the table. This is really what is key to them. However, if you're interested and you want to learn more, why don't you jump to, for example, the New England Journal of Medicine, right? Because here you will find some descriptions, well, original research from clinical trials, right? And you might as well have a look at the Lancet as well to see how they describe all of this. It's definitely very, very useful. So having said all of that, you do have all of this information in the link in the description down below. But moving from that, there are a few other very, very important features that medical writers need to demonstrate. And when we ask you all of these questions at the interview, we will really be looking to see that you are flexible and you are a great project manager. And let me now explain to you what I mean by this, because you need to be in this mindset to answer these questions. A regulatory medical right faces a lot of changes all the time. So what happens is that we receive feedback from health authorities and they tell us to change something completely. We suddenly need to respond to them and write a completely different set of documents. So you as a writer might be in a situation that your line manager will come to you and will say, well, this is the answer we've just got from FDA. We need to respond and we need to produce such and such set of documents. And I know you've never written this before, but could you please take this on, right? And suddenly you need to reprioritize your work and write something you've never written before. Perhaps work with people you've never worked with before, right? So it's a lot about being flexible, being able to suddenly take on new projects, juggle multiple projects, and also be mentally prepared to stop writing a document halfway through and rewrite it, completely rewrite it, or maybe even drop it and write a new document, something completely different. So you need to be flexible. And when they ask you questions like, how did you go above and beyond for a client, for someone else? What they're looking for is just to see that you can reprioritize, you are flexible, you're not afraid of change. And that's it. And the other thing we're looking for is that you are a great project manager. Why? Because medical writing is really all about managing a team. Because you're not able to write all of these documents on your own. Because you need a physician, you need a statistician, you need a pharmacologist, you need someone from clinical operations, right? There are a lot of people involved in the process. And you will need to work with them, you will need to make sure that they all agree and they give you all the information you need to write high quality documents. And because of that, during my own regulatory medical writing interviews, I was asked 3 times about conflict resolution, how I managed a conflict. So think about multiple examples of how you're flexible, of how you can manage multiple projects, manage your time, how you work under short timelines, under pressure, and how you can resolve conflict, how you can build relationships, how you can motivate people to meet the deadlines, to give you the information, right? So I know it's a lot to ask, but I'm sure you've been through a lot of difficult situations and you can quickly bring them up. And that's the point. You need to talk about real life situations that you have experienced because they are the most compelling. And the way to describe them is by following STAR method. STAR stands for situation, task, action, result. So, situation, what was it? Task, what did you have to do? Action, what did you actually do? Result, what was the outcome of your action? And if you explain your answers in this way, then they will exactly be able to pinpoint that you're flexible, that you're a great project manager, that you can lead people, and all of that. That's so important. Of course, they might also ask you some generic questions, right? Like they would ask you at any other interview. So could you please introduce yourself to us? Why do you want to work for us? Why do you want to leave your current employer? Right? Standard questions. But don't spend more than 1 minute per question to answer them. They just want to see your intentions. They just want to get to know you a little bit, who you are, what are your motivations, what drives you. But these are some basic questions, and you really need to focus on proving to by bringing examples from your life that you're flexible, you're a great project manager, you can manage people, you can manage tasks, processes. And speaking of processes, but you're also actively thinking and working to improve the processes. So the first time you do something, it's okay, but the next time you do it, it's better. And I'm sure you've done this in your life, but you've done an experiment, you've done something, and you were like, well, it could be improved here, and you came up with this. You went to other people, you told them, and you suddenly improved, the life and the work of multiple other people, and that's really important to point out how you contribute to a team because as a regulatory medical writer, you will always be part of a team. You will be the only writer on the team. There will be a lot of other people, and you will need to be there in the center to bring them all together, and you will drive decision making. So it's really important that you always think about how to improve the processes, how to improve decision making. And I think this is it. So if you need any extra help, feel free to reach out in the comments or via email, and I'm sure you'll be fine and you'll pass the test and the interview.